On the line, we have Aaron Wilson with the City Planning Department, Ann Hughes, our Chief Operational Manager, Chet Crowser, Director of Community and Planning Services, Cindy Farr, Incident Commander for COVID-19, Commissioner Dave Strohmaier, Emily Herndon from Bonner Milltown, Jennifer Schultz from Lolo, Commissioner Slotnick, Commissioner Vero, Kevin Noland from Lolo, Lori Heyer, MCAT's with us tonight streaming, and Melissa Gordon from Community and Planning Services, and Tom Browder from Seeley Lake.
Thanks a lot. So thank you all for coming. These meetings are really important to us in that this is our main connection to the community councils right now. This is our opportunity to hear from you all what's happening out there in Lolo and Frenchtown and Seeley Lake and West Valley and Bonner and Milltown and East Missoula and all the rest of it. So we really appreciate this opportunity and that you would take the time to chat with us. We have what I feel like is an exciting community council meeting for this evening, and that we have some super timely and valuable updates. Cindy Farr from the Health Department is here, which is super important given all that's going on. Aaron Wilson's also here to talk about the long range transportation plan, which has an effect on pretty much everyone in Missoula County. Chet Crowser from CAPS is going to talk about some of the summer parking issues. Well, I just hit a bunch of echo there. Hopefully it'll go away. So Chet's going to talk about some of the summer parking issues, and I might chime in a little bit on that as well. And then Dave, our very own Dave Strohmaier, is going to talk about the hottest thing crossing South Central and Eastern Montana since TikTok, and that is the Big Sky Rail Authority. So we're going to hold that off till the end because it's the most exciting. So with that, oh, and then we're also going to have our kind of roundtable question and answer that Sarah has organized. So with that, we're going to hit the health department updates first. So hopefully Cindy Farr is on and can dive in there.
Hi, everybody. Yep, I'm here. I'm just going to let you know that I am here from home. So if you hear little dogs or little children in the background, I hope it's not super distracting. So the health department, I think many of you know that since the last time we talked, we are definitely seeing a resurgence in COVID cases in our county. We're also now experiencing a lot of delays in test results. And so that is not unique to Missoula. It is something that is definitely happening all across the country at this point. The labs are just super overwhelmed. And so I don't know if you got a chance to tune into the governor's press conference today, but they are trying to figure out some creative solutions to get us test results in a more timely fashion. But we have been experiencing a 2 to 3 week delay in getting results, which is super not helpful for us, because by the time we get a positive result from 3 weeks ago, that's a whole bunch of people who are contacts to that case that didn't get quarantined that could potentially develop the disease, and we were never even able to timely notify them of their exposure. And so one thing that we are doing at the health department to combat that is that we were able to procure a rapid testing machine from the state health department, and they have let us know that they can allocate about 250 tests a week for our rapid machine. It's gonna take us a couple of weeks to get it up and running because we need to calibrate it, and then we also need to go through and change some of our protocols, because currently we're seeing people every 6 minutes at our testing site, and our rapid test results take up to 18 minutes to get a result. And so we're going to need to change kind of the way that we're doing to accommodate for that extra time. But we think that that's going to be more beneficial than waiting 2 to 3 weeks to get test results back. So they also announced today that in addition to contracting with a couple of new labs, they're also at the state level going to be contracting with MSU Bozeman to run some of the asymptomatic tests that are coming in. So for example, when we are testing employees at a nursing home or long-term care facility, then those kind of tests would get processed at MSU Bozeman instead of at the state public health lab. and instead of getting shipped out all the way to North Carolina, which obviously is going to cause some delays in getting results in. With the new mask mandate for Missoula County, and then a week later, the governor coming through with additional mask mandate, there are a lot of questions about who is supposed to be wearing a face covering when they're in public, and how businesses are supposed to be implementing that. And, you know, we've gotten about, I'd say 150 complaints in the last week about various businesses that people don't feel are actually implementing the mask mandates. And so our environmental health enforcement branch has been doing a lot of outreach with the various different businesses that we're getting complaints about, to talk to them about how to approach customers about wearing a face covering and reasonable accommodations that might be able to be made for customers who can't, for some medical reason, be able to wear a face covering, and kind of just talking through what some of that means. We've also now gotten a lot of questions from businesses that are wanting to know what's going to happen to my business if I get a positive case of COVID in one of my employees. And so we put out some business guidance for them that we jokingly call what to expect when you're expecting a case of COVID. And they seem to be really appreciating that guidance, because I feel like even though we've talked about it a lot, just having something in writing that they can refer to say, okay, this is how it could potentially affect my business or my employees. And, you know, it helps to reinforce the things of trying to keep your employees socially distanced, because if they're socially distanced and you get a case, then it's not going to take out all of your employees by making them all go into quarantine for 2 weeks. We have had that happen a few times, and I think other businesses are learning from some of the more high profile businesses that have come out and announced that they had to close because they didn't have any staff left and they couldn't operate their business. And so I think that, you know, people are learning from each other about different things that they can do to help prevent that from happening to them, and also working with our team to help troubleshoot some of those problems. So that's kind of my very short and fast download on what we've got going on at the health department. We're also working to, nationally, we're seeing a decrease in childhood immunizations due to parents being scared to bring their children into a medical provider, thinking that they might get exposed to COVID. And so that's a big problem on a lot of fronts. I mean, the last thing that we need is a measles outbreak on top of COVID, or, you know, some other type of vaccine preventable disease. So we are trying to work with our community partners and get some more information and outreach out about making sure that children are still receiving the vaccinations that they need, and safe ways to do it, and how to contact their provider. And we're changing our immunization clinic to appointment only, which for those of you who have been around the county for a long time, this is a huge change for us. We have never ever done immunization clinic on an appointment basis. It's always been walk-in, first come, first serve. So we're sort of revamping how we're doing things so that we can make sure that we're keeping people as safe as possible in our own clinic as well. So with that, I would like to just turn it over to y'all for questions, and I'll just let Sarah facilitate that.
Yep. So I was thinking maybe a way to streamline the questions tonight, since we have a bigger agenda, if we could just go through each council, and if there's one council member who has a question, do you feel okay with that, or do we want to go through the entire list?
Hey, Sarah, there's also, this is Dave, there's also the function for folks to raise their hand if they want to say something. Could that be an option?
It definitely can.
Hey, Sarah,
We
this
do
is
have
Jerry.
Sarah,
Yeah,
I was
called in.
wondering
This is
what.
Jerry from. Go ahead.
Sarah, why don't we do that? Raise our hand, but then we'll put a time limit on it. Like if we look at the agenda and figure out we need 10, 15 minutes, whatever it is for this, and we'll just call it when we get to that point, but let people raise their hand.
Okay, we
this
do
is
have two
Jerry.
people on the phone.
Yeah.
Do you think that's doable?
How do
Maybe I'll
you
just go through the
how do you
list.
raise your hand?
when
You know, just-
when you're
just
on the
raise
I'll
it.
just
phone.
run through the. I'll just run through the list. So let's keep it simple
I'm
here.
sorry.
Okay.
Sorry.
That's okay. So let's first start with Tom Browder up in Sealy Lake.
Sure, and this is probably something I should know, but as we've talked before on these, we have a lot of tourists up here. If an out-of-stater needs a test, has that changed at all from the last time we talked? If they think they may be symptomatic?
That has not changed since the last time that we talked. They would still be referred to go to one of our walk-in community partner clinics to get that test done. The ones that I know of for sure that are still doing testing for pretty much anybody are Cost Care on Russell Street. We've got First Care Northgate on reserve and Grant Creek Family Practice on reserve. And then the Frenchtown Family Practice is also doing COVID testing, as well as Curry Health Center is taking care of their own students and faculty. But yeah, we would refer them to go to one of the walk-in clinics.
Great, thanks, Cindy.
You're welcome.
Hey, Jennifer and Lolo.
Hi. So we just got notification that Kevin wants to have another in-person meeting in August. And based on the last meeting where we had the folks who purposely moved their chairs together, I'm super concerned. I also work in a place where I've had to ask people to put their mask on and leave. So I'm really concerned that we're going to have folks that won't comply. So I would like a little guidance there. I think that we are asking for trouble by having an in-person meeting. I didn't know what we should do about that.
Well, my 2 cents on that is that right now, and particularly next month, as we're starting to see university students coming back, and we are expecting to see a spike in cases as people are starting to get together with back to school and everything, that I would not recommend doing an in-person meeting. But if you are going to try to do an in-person meeting, I would recommend to you that you reach out to our environmental health staff and get some advice from them on the best way to make sure everyone is protected.
Thank you.
Kevin from Lolo. You're on mute, Kevin.
Yeah, there we go. Jennifer, I don't think that was the appropriate place to answer a question if you felt. I sent an email yesterday asking the council if they felt a public meeting should be warranted. So I don't, Jennifer, maybe we can keep personal council business to the personal council and not bring it to this format. Cindy, my question to you is how many tests do you have results or, I mean, records for? I see the testing lab out in Lolo periodically. Do you have a count on how many tests have been done there?
I don't actually. We get collated information, so we get the numbers for how many tests are being run cumulatively in the county, but we don't get the numbers for each individual clinic. Well, we get them, but not in a way that is easy to report out, because basically what happens is each clinic faxes us at the end of the day all of the names of the people that they tested, along with their contact information, so that if any of those tests come back positive, we have it. But because that's our system for getting that information, so that we have the contact information for people, we don't track how many tests are occurring at each clinic separately.
Okay, cool. Appreciate that. The other question I have is, when you come out to businesses, are you basically just responding to complaints, or is there random just cold calls, or how are you guys determining where you're going to?
Yeah, so our enforcement branch has always been a complaint-based paradigm. So that basically means that if we get a complaint about a business, then one of our environmental health sanitarians follows up with that business. And they typically go out, they talk to the manager, they take a look and see what's happening in that place of business, and then they educate them on, you know, what the rule is, along with helping them figure out solutions to implementing the rule. So that's kind of how our enforcement stuff works.
Very good. Awesome. And then one other question. I will submit our plan to your health department before we decide to have a public meeting. The community center is having activities there, and so we'll follow their guidelines that are in place. And the question I asked is if we should do that or if we should have a similar format to this, and I've already got it scheduled with a Google Meet invite. So yeah, we'll take care of that internally. I don't know if that's the right dialogue for this meeting, but I appreciate your input, Cindy. One more question. Nate Kalkofen, who's not able to attend this meeting tonight, wanted me to ask about, there's an uptick in drug crime in Missoula, parks. Are we focusing too much on COVID and letting some of the other activities, you know, the news today, we heard about a heroin addict trying to take a 16-year-old girl. And you know, that I hope that's an isolated incident, but it just doesn't feel safe and clean around some of the parks in Missoula. Is that something being focused on, or how do we work on that?
So I can help answer that question from the public health side, because part of the work that we do in other areas of public health that happen to fall under my purview when I'm not running a pandemic is that we do a lot of work around substance abuse prevention and substance use prevention, as well as working with our community partners for syringe pickup and cleanup and all of those kind of things. And so I know that our partners are still actively working on those issues, but I don't know a whole lot about any other, like the law enforcement type side of that. So I would leave that.
Can I speak to something on that? So Kevin, I think I'm going to try and read into that question a little bit, but I think that there's a portion of the population out there that is, and it may be that the man you're referencing feels this way, that we're spending far too much effort on COVID. And the information there is that law enforcement shouldn't be involved. Well, actually, law enforcement isn't involved. This is a health department issue in terms of enforcement. So the same amount of law enforcement 6 months ago, as it is now, is out there attempting to solve drug crimes, stop violent crime, stop property crime. Not one iota of law enforcement energy in Missoula County has been slid off to COVID.
Good.
So that kind of intimation of, oh, you know, drug crimes are up because y'all are spending your energy on COVID, it's just flat out wrong, if not a lie. There is no law enforcement energy spent on COVID. There you go.
Good, Josh. Thank you for that answer. And then I would probably maybe add to that with this pandemic, there's other issues that are starting to come out in the forefront that are law enforcement issues as opposed to health. So, Josh, I'll pass that along. Thank you. And then I'm done with questions.
Thanks, Kevin. Devin and Lolo, do you have anything?
Yeah, 1 second here. So with regards to health department, last time we asked about your communication with the other counties, and I know Ravalli County has had some issues and changes because of the governor's order since then. Has that changed our relationship with finding out what's happening down there, or is communication still open?
So we actually have better dialogue now than we had at our last meeting. The EOC in Missoula County has stood up our daily calls with our surrounding counties, as well as businesses that kind of overlap some of those counties, such as Forest Service and Northwestern Energy and some of those businesses. So we do actually have daily communication with our surrounding counties. There has definitely been some changeover, and we are definitely handling things much differently than Ravalli County is. And, you know, they have that political right to decide what they're going to do in their county. But at least we are actually having daily communications with folks from Ravalli, as well as Rocky Mountain Labs and some of those bigger entities that overlap multiple counties.
Okay, thank you. With regards to, obviously, we're now restricted from several states. I was supposed to be in Ireland over this month, and clearly that wasn't going to happen. So since there's all these restrictions on our travel, is there any restrictions or any planned restrictions on incoming travel? Texas is a big hotspot, and I'm seeing a lot of Texas plates right now.
Yeah, so I know that the governor spoke to this on his press conference today, and I can tell you that from the Missoula County health officer standpoint, it doesn't really make a lot of sense for us to try to restrict travel into Missoula County unless our surrounding counties are also restricting travel. And as we know from looking at the difference between how we're handling things and Ravalli County is handling things, I don't see that happening anytime soon unless it becomes a governor mandate. And he basically said today that that's not something that he's considering at this time.
Hey, Devin, this is Dave. If it's any consolation, I have heard that Lolo is the Ireland of Montana. So
we're pretty green. It's nice. It was supposed to be a big family reunion, though, so unfortunately. We'll do it next year. That's the idea. So the last thing, obviously, we've been discussing our plans for having a meeting next month. This just came up, and it's harder and harder to say we shouldn't do this when the schools are saying they're going to open at 100%. Obviously, it seems unsafe to me, looking at the numbers now and the numbers when we shut down the first time. So I'm kind of stuck wondering, obviously, we serve at the commissioner's behest, and so I was wondering if there's any direction from the county or from the commissioners or the health department as to whether or not we should be doing this, or if it's still left up to us.
So I can speak to your concern with the schools. I have weekly meetings with the superintendents of all of the school districts, including Lolo as well, and basically help them determine at what point it is safe to reopen and should they be reopening at full capacity. And at this time, they are actually all really leaning towards a more phased approach while watching what our positivity trends are as far as like how many new cases that we have coming in over the 28 days prior to when school is going to start. So I think that is definitely, they're definitely thinking about that, and they're trying to figure out if it's safe and at what point it would be safe. So I don't think that they're at a point where they're going to decide to open 100% on the first day of school. I think they're just wanting to watch the data for about the next month on that, and I'll let the commissioners speak to your other concerns.
So Devin, this is Josh, and I know that the health department has rules on outdoor gatherings, and Cindy may be able to recite them. I can't write off about the number of people in one place and the social distancing, and you guys may be able to pull this off outside. And that may be a way to do it if you have a facility where you can accommodate that many people, everybody 6 feet apart. I don't know what facilities you have available to yourself, or if you sit out on a soccer field or something. I mean, obviously the safest and most reliable way to do it is just online. But if you're dead set on doing it in person, I would look towards outdoors and follow the health department's rules on outdoor events.
Well, the weather's pretty good right now. The commissioners are still doing remote meetings for yourselves?
Yes. Yeah, Devin.
Yes.
So I was going to say, this is Dave again. If I think Josh is spot on in terms of if there was to be a meeting, certainly outdoors would be preferable, I think, to indoors. And we've had some of this discussion with us in terms of our meetings, but the challenge is with needing to record meetings with some of the technology that's involved. Doing an outdoor meeting for us, public meeting, just is not feasible. But I would say, to the extent you want to take your cues from the commission, we are not having in-person public meetings for the foreseeable future. So do with that as you will.
Thank you. Thank you, Cindy.
Hey, also, how do you control the crowd? That's my biggest question. You don't, right? So
yeah, and those are some of the things that the environmental health staff could try to help you work through, but that is sort of the way it works, is that you need to have a plan in place for how to crowd control and maintain social distancing and keep people away from each other when they're entering and exiting, you know, like the whole deal. Right. So they could definitely help with that.
Thanks.
And I can tell you from vending at farmers market, it can be done. You just have to have a plan, a set of rules, communicate the rules, and follow them. It's not the smoothest and easiest thing, but it can certainly be done. You have an entry, a marked entry, a marked exit, one-way flow, 6 feet apart. You can mark spots on the ground with blankets where people can sit. Plan for 20% more than are actually going to come. It's a pain in the butt, but it can be done. Environmental health people will talk you through it and really help you create a plan. They're super good at that.
Great. Next, we have Douglas Combs from East Missoula. Oh. You're muted, Mr. Combs. You're going to have to hover over your screen and find the little thing that looks like a microphone. It has a line through it. If you click on that, you'll unmute yourself. Do you see a gray bar over your screen? If you kind of wiggle your mouse over everyone's face on your screen, there should be a gray bar that pops up. There's a little icon that looks like a microphone.
There I go.
There you go.
I'm sorry. What I was going to say is, what are we? Just like little kids? I mean, we're all humans. Sure, we probably think we are mortal, but at the same time, the health department has come out with all these guidelines. If we use them, if we believe in them, and if we know that this thing can kill us, why not? It's the best way out. I'm sorry, but I want to be blunt here.
Well, I super appreciate your support, Mr. Combs, because that is what we would love for everybody to say, is that we're coming out with the guidance and people should just follow it.
Well, I'm in the age group that in the beginning was very susceptible to this. I'm 82, and I prefer my life to being gone. So I have faithfully done everything that you people have asked me to do. There.
I think we lost you there for a second.
So that's why I don't know, they're simple rules, and personally, some of us, not you guys included, but me, look better wearing a mask. If I didn't wear my mask, I'd probably scare you. Thanks, that's all I had.
Thanks. Yeah, again, we super appreciate the support. I wish everybody felt like you do.
Thanks, Mr. Combs. Lisa Thomas, do you have anything?
Yeah, I had a quick question on when you do testing and it's taking 2 weeks or more to get results back. Is there a recommendation or guidance on those people quarantining, self-quarantining until they get their test results back? Would that help with the contact tracing later on or anything like that? Is that something that is, I don't know, suggested, shall we say, rather than you can't force people maybe to stay home, but are you recommending that? And then I have another comment too after that.
Yeah, that is definitely what we are telling people, is that if you get tested, then we are suspecting that you might have COVID. Otherwise, you would not be getting tested. And so it's really important for them to isolate themselves away from other people until they get their test result back. I understand that that was really easy when it was taken 24 to 48 hours to get a test result back. But when we start looking at 2 or 3 weeks, people get really tired of doing that. And so we're actually trying to put out more education for those folks, that basically we're asking you to quarantine yourself and isolate until you get your test results back. But if it takes longer than a couple of weeks to get your results back, then here's the criteria by which you can release yourself from that isolation, which would be 10 days from the onset of the symptoms, 24 hours without a fever, without fever-reducing medications, and an improvement of the symptoms. And that way, for people that are experiencing a financial hardship waiting for 3 weeks for their test results to come back, if they meet that CDC-based criteria, then they can let themselves out of isolation, and then we still try to go back and do contact tracing from the time that they were contagious.
Okay, do you check in? I had 2 weeks of self-quarantine in March due to travel, and the county health was checking with my home every day and checking on symptoms for the 2 weeks that I was in my home. Is that being done with people who are tested? Is there a follow-up about symptoms and whatnot after the test?
So the people that are tested, we're asking to quarantine because they're getting tested, they get all of that in an informational packet, but they are not getting a phone call every day. Once we have once they're a confirmed contact to a case or they're a confirmed case, then they do get monitoring every single day. And some people, like, I don't know if we were using the app or not when you were in quarantine, but we now have an app called Patient One, and for people that are a close contact to a case, they can download that app to their phone, and then instead of having to get a phone call from us, it just sends them a push notification a couple of times a day and says, what's your temperature? Are you having any of these symptoms? And then if they put a higher than 100.4, or they say, yes, I'm having these symptoms, and a public health nurse calls that person and facilitates getting them in for a test. Some people choose not to do that, and for the people that choose not to use the app, then we do still call them and ask them about their symptoms and facilitate getting them in for a test. We also check in with people that are a confirmed case every day for a couple of reasons. One, we want them to verify with us that they're staying at home while they're contagious. And the second reason is that, some people are really hesitant about when they should receive medical follow-up. And so our nurses check in with those people that are a case to make sure that, if their symptoms worsen, that we can help facilitate them getting some medical care instead of having them feeling like they're just kind of out there on their own figuring out how to manage this disease. So yeah, we try to have pretty close contact in that way, just not for people that are just awaiting test results.
Okay, thank you. Those are my questions. And my comment is, I thought the question about in-person meetings and containment and how to run an in-person meeting was very appropriate for this meeting, so that other community councils, should we move towards public meetings in the fall, as things start to open up, hopefully. That was good information for all council members to hear. So I think the woman from Lolo who asked the question and started that conversation was right on point, and I thank her for starting that conversation. I got some good information for my community council. And with that, I'll close. Thank you.
Thanks, Lisa. Emily Herndon in Bonner Milltown, do you have anything?
Sorry, little children. No, I don't. Thank you, Cindy, though, for all your good information and all up to date and providing us different directions for questions and everything else. So I appreciate it. Thank you.
Thanks, Emily. Jerry Dallas, West Valley, do you have anything?
Yeah, I have a question, Cindy. I think I understand this correctly. So if you get tested and it's taking 2 weeks, to get the results back. And so every day at 10 o'clock, am I understanding that those numbers are conceivably from tests that were 2 weeks ago?
Yeah, so those numbers for the updates of the cases that we put out at 10 o'clock every day are for all of the test results that come in, and some of them are from a couple of weeks ago. We are hopeful that now that they're switching over to a different lab and which supposedly is gonna start improving things starting tomorrow, but I'll believe it when I see it. But we are hoping that turnaround time is going to be back down to that like 72 hours. But we'll have to see how it goes. But yeah, that's correct. Those numbers that are updated every day do include some of those test results that came in that got tested a couple of weeks ago.
So do you feel like, I mean, obviously that information is a little bit skewed. Do you feel like you're seeing an uptick or not?
We are definitely seeing an uptick. For example, we got 19 cases between Saturday and Sunday, and none of those were tests that were run a couple of weeks ago. Those were all tests that were run towards the middle to the end of last week. So that's a lot of when we're seeing the ones that are coming in from a couple of weeks ago, we're actually just seeing those a handful, because just in the last week or so, we're starting to see a more significant uptick, even compared to the week before. So yeah, we're definitely seeing an increase in cases.
Okay, and then my other question was, this is probably a dumb question, but who is getting tested? Are people who are asymptomatic getting tested?
No, it's actually, right now, I don't know of any asymptomatic people that are getting tested other than close contacts. Basically, we stopped doing asymptomatic frontline workers because we had such a run on people that were actually having symptoms or people that were close contacts of a case that we just had no more appointments left once we tested those folks.
Okay, so if somebody says, I didn't have a mask on, I tested positive, these are the people that I was around, you contact those people and ask them to get tested. Is that how that process works?
Yeah, and actually it's when it comes to the mask, there's a misconception that if you're wearing a mask and then you're next to somebody for 15 minutes or more, and even if you're both wearing a mask, that you would not be a close contact. You would still be considered a close contact because we know that the masks are not 100% effective at preventing the disease. We just know that it reduces the transmission rate. And so when we identify a case, our nurses call that person and they say, okay, when did you develop symptoms? Let's look at up to the 2 days prior to the first symptoms until we got you into isolation. And we need to talk about all of the people that you may have been around within 6 feet for 15 minutes or more. And that's a cumulative 15 minutes. So if you're thinking about going to a restaurant, for example, and you are a patron at the restaurant, you may only see your server for 2 or 3 or 5 minutes at a time. But if you're sitting in that restaurant for 2 hours having a lively conversation with your partner, that 15 minutes adds up pretty fast. And so So we try to think through all of those kind of scenarios where you may have had a cumulative exposure, and then we contact all of those people and let them know that they were exposed. And then we try to get them in for testing at least 3 days after their exposure, and they still have to quarantine for the full 14 days. But we've actually caught quite a few cases really early and got them, we're able to get our case investigation and contact tracing done early on those by getting them tested really early after their exposure.
Okay, thank you. That's all I had.
Thanks, Jerry. Tom Tucker in West Valley, do you have anything?
Yeah, I've got two comments. One of them is I stopped at the Frenchie's gas station here the day before yesterday, and I noticed that there were some people that came in. They were they had Idaho plates on their rig, walked into the Frenchie's store, their convenience store, no masks, and obviously they were Russian, but they didn't follow the rules that was on the door that said that they were supposed to come in with masks on. And most of the people that do shop there wear masks as well as myself. How does somebody address that?
So we've
they're
actually
not following the rule, so.
Yeah, we've had that, that's a very common problem with travel centers, especially along the interstate. And so our environmental health sanitarians have actually been going out to those various different businesses, particularly those travel centers, and making sure that they're empowering the employees to understand how to best approach someone who might be walking in that maybe they're not from Montana and they don't know that there's this mask order in place. And so that's how we've been handling it at this point, is that when we find out, we've got people that are doing some kind of spot check educational visits to those types of establishments, so that we can make sure that we can give them all of the tools that they need in order to feel empowered to ask people to put those masks on.
Yeah, but see, that doesn't do any good when they get out of their car and they walk in the store without, apparently they don't know the rule. The county rule says you don't go in an establishment unless you're masked up. But obviously they don't know the rule and they don't follow the rule, even though it's on the door. So what do? Have somebody stand at the door and say, you don't go in there unless you got a mask on? That's the only way I can foresee to take care of it.
Yeah, and we've actually, I know that there have been some conversations with various different, particularly big truck stops, about having exactly that kind of a person who basically can stand there and hand out a mask to people that are walking in, or and there are resources available that a lot of places don't understand are available, where they could actually be getting free masks to hand out to their patrons whenever they walk in the door without one. And so that is what our environmental health specialists have been working with those types of establishments on, trying to figure out creative ways to fix that problem. I think that more and more states are starting to have a mask or face covering mandate, and given that ours has only been in place for a short time, I think it's going to become more and more normalized. But there's definitely going to be this hiccup period of time where we're trying to get everybody educated and empowered and figure out good strategies for fixing those sorts of problems.
Well, that's the problem. See, they come in off the interstate, grab some treats, they're in there for 5-7 minutes and they're gone. So the other question I got is, I know a couple that said that they had the virus, and then they said they were, and they don't wear masks no matter where they go, and they go to town just about every day. So they say that they don't have the virus, but they've had it because they were tested positive. They quarantined for about 7 days. They kind of fibbed to me and said they'd stayed home for 14 days, and I know better. But if they've had it, they're still carriers on that. Is that correct?
So no, there's actually just an infectious period where someone can actually pass on the disease to other people. And that's a fairly short infectious period. It's generally, for mild to moderate illness, it's generally about 10 days. For people that are severe or critically ill and it like really wipes them out, then they can have a contagious period that could be up to 20 days. But for most people, what we've seen is mild to moderate illness, so they can only spread it to other people for about 10 days after the beginning of their symptoms. So the other thing is that a lot of people have been wanting to rely on an antibody test, or they believe that if they've had it before that they might not be able to get it again. And I just want to caution everybody that we just don't know at this point. There's not enough research available to know if you really do develop a good enough immune response to protect you from future infections, or if maybe you develop an immune response for a short period of time, but then it wears off. We just don't have enough information about that right now.
Yeah, well, I'm still staying away from these folks, and 7 to 10 days, and they say that they had it, but they're not infectious anymore. So. And that's all I have, so thank you.
Yep, thanks.
Thanks, Tom. Cindy, I think
You're
that's
welcome.
everyone.
All righty.
Did you have anything else you wanted to add?
Nope. Just want to remind everybody that I know there's been, it's something that I think has come up since the last time I talked to y'all. So just a reminder that right now what we are seeing as far as infection is we're seeing a lot of connected infections. So people are giving it to their family, their friends, their loved ones, and their coworkers. It's not being imported from outside areas at this time. We really are just giving it to each other. So it is really important to continue to think about all of the things that we were doing back in March and April to try to slow the spread of this disease. And those things are still applicable now. Try not to be going out all the time. If you are, make sure that you're taking those safety precautions, like making sure that you're washing your hands, that you're, really monitoring yourself for even the slightest symptoms, and staying home if you think that you might even just have a sore throat, because even that in and of itself could be a symptom. And don't go to work, and don't be around your vulnerable family members if you are having even the slightest thing that you think might be allergies. Because that's what we're seeing, is that people are having mild symptoms, they attribute it to something else, and then they go to a family reunion or they go to work, and then they have infected all of the people around them. And so that's just the one last little thing I just want to remind people of.
Thanks a lot, Cindy. So our next up is Aaron Wilson, who's going to talk to us about the long-range transportation plan. And Aaron, given the time, we may need to do a condensed version.
I think I can do that.
Could you do it entirely in acronym? Maybe a few connective tissue words, but
yeah, I think I could. But I'll try to spare you all as many acronyms as possible. If I can, is it possible to? I'm going to try to share my screen. I do have a kind of a PowerPoint, and I'll go through it. I'll cruise through. I can probably skip some of the slides, but let me see if this will work. All right. Can you all see the screen that I'm sharing?
Yes, it looks great.
Excellent.
Yep.
Well, I guess I'll start. Thanks for having me. It's good to, I feel like we don't often get enough time with the community councils and residents who are maybe outside the area where we regularly look at transportation elements. But for those of you I don't know or haven't presented before, I'm Aaron Wilson. I manage the Missoula Metropolitan Planning Organization, which is kind of a regional transportation planning body that covers the city of Missoula and then the urbanized portions of Missoula County, sort of surrounding the city. And one of our primary tasks that we have is coming up with a long-range transportation plan for that area. So we look out 30 years. We try to anticipate what funding, what transportation needs we're going to have, and come up with a plan for how we're going to grow and how we're going to continue to be able to move around the region. But I will say our planning area is an even larger area. We look as far away as Lolo and Frenchtown and Tura and Clinton. And then even further, we know that people are traveling into the region from even adjacent counties. And so all of that input is really helpful for us when we're crafting this plan and thinking about how people move around the region. So just real quickly, in the long range plan, we look at all modes of transportation. We look at all of the infrastructure we have that support those. So we're looking at bridges, we're looking at freight movement and truck routes, we're looking at bicycle facilities, regional commuter trails, we're looking at transit, and we're collecting data and evaluating all of the pieces that fit into mobility and how we're moving around the region. And there's quite a bit of infrastructure out there and trips. Some statistics that I think are relevant or interesting. Maybe we see as many as 27 trains per day. There are over 25,000 commercial trucks per day moving through the Missoula area. We have nearly 50 miles of bike lanes, and we see a lot of bicycle activity in the region. We were actually just named one of the top 5 cities for biking in the U.S. recently by the People for Bikes. So we have a lot of biking, we have a lot of support for that, and we have a lot of transit. The number doesn't actually show up on here, but about 88% of the Missoula area residents live within half mile of a bus stop. So there is a lot of transit ridership, and it's something we need to plan for. So we also know that the region's growing. Since 2010, we've seen at least a 5 or 6% increase in population. It's actually probably more than that. The more recent data we have is from 2017. We're in the middle of a census, so we'll know better in a year or so. But we're a growing region, and we need to figure out how to accommodate that growth. We also look at the needs of the community in these long-range planning processes. So we know that there are some core issues that we have to address, including affordability and accessibility for people. Within the region, we know about 14% of residents are below the poverty line, and so there's a real issue in making sure that transportation isn't unnecessarily impacting, that people can still move around. 13% of the population has a disability, and so thinking about how our transportation system is accessible, and just thinking about all those other different kinds of people who need to move around and the specific needs that they have. In the last plan, one of the ways we are hoping to accommodate that future growth and think about transportation is setting what we call mode split goals or mode share goals. So thinking about how people get around, trying to encourage as many people to bike and walk and bus as possible, which just allows us to take the existing infrastructure we have and get more use out of it. Currently, about 71% of people drive alone as their regular way to commute to work. And so our goal in the last plan was to get that down to cut that in half down to 35%. And so we have a long way to go and a lot of work to do to get there. And so that's something that we're thinking about, how we can make that possible for people. So updating the long range plan, it's a plan that's looking ahead to 2050. So I know it can be hard during the time of COVID to be thinking about transportation 30 years in the future, but a lot of what we're doing is going to impact investments that we make in the next 5 years, in the next 10 years, and thinking about what our priorities are. And so it's a good time for us to think about that, and also just to think about how resilient our transportation is, and can we respond to things like a pandemic, and does our transportation system work, and are there changes in how people are going to be moving about because of things like COVID? Are we going to see more telecommuting, or people not wanting to ride transit? There's a lot that's changing and kind of up in the air, and so it's an interesting time to be doing long range planning. But we update this plan every 4 years, which seems like a lot, but it also allows us to look back and have a very responsive plan that changes to those changing conditions. Within it, we try to set the projects, policies, programs that help us achieve those regional goals that we're setting. And public input is a really critical piece of that, and particularly all of you who are maybe living on the urban fringes or outside of Missoula, but regularly commuting in. I think that's a perspective that we really want to hear about and understand what your transportation needs are and will be in the future. So the way we've started approaching it, we're kind of midway through this process. And so we've done a lot of work over the last 4 to 5 months. Obviously, COVID happened. Right after we started, we had a kickoff back in March, which this picture here shows. We had an open event on a first Friday where we looked at the history of Missoula and went back in transportation history all the way to the late 1800s and looked to see how things have changed, how some things are maybe the same, and just trying to use that to understand where we might want to go for the next 50 years. Since then, COVID hit shortly after that, and so we've had to rethink our involvement. So we've done a lot more virtual meetings, but we have a number of committees that we've met with. We've been trying to go to other meetings like this one and not necessarily just create our own public meetings or other opportunities that people have to come to us, but go out and engage with the community. We have a lot of resources on our website, including some videos that you might want to check out. We've done a lot of work evaluating where we are today, our existing conditions, and we've been working on our goals and outcomes, and are now into looking at what the potential projects might be for that next 30-year period. So we also, in this, again, it's a 4-year update, and so we're not starting from scratch, but we have done some work to look at how things have changed over the last 4 years, but we really want to focus on building on what we've done in the past. Thinking about leading with our values, so thinking about what those values are and how transportation is going to help address those. We've also heard a lot over the last few months that there's a really key need to connect urban and rural and people living in those different places, knowing that I think the statistic is maybe as many as 25% of people who work in Missoula are commuting from outside of Missoula County. And so that's a challenge that we have as a regional center, and it's only going to be more so as we continue to grow and people continue to need to work and access services. We also really want to focus on integrating land use and transportation. Those pieces are it's essentially impossible to separate them. The way that we grow and the types of development that we see has a huge impact on our transportation system. Things like, are people able to live near where they work? Are there services accessible that they can walk to or bike to for their errands? And really thinking hard about that and how we're growing and what that means for our transportation system. And then we really want to make sure that our transportation system is safe and reduce fatalities and serious injuries. And then finally, just thinking about preparing for an uncertain future. Know that COVID has really highlighted how uncertain that might be. So I won't ask this. Typically, we like to have a little bit of interactive and get people's big idea for what the future of transportation in Missoula is. I won't open that up for questions now, but if people want to type into the chat box, or maybe when we get to questions, people can, when they're asking questions, just think about what your big idea for the future of transportation in Missoula is, and think, creatively about how we might continue to grow and have a transportation system that works for all of us. So I mentioned goals and values are really driving what we're doing in this plan. And as we're developing these goals, we're not starting from scratch. We're building on a number of things that have happened in the past. We have federal goals and planning factors that we're required to plan for. That we manage all the federal funding that comes into Missoula at the MPO. And there are requirements that come with that in terms of those nationwide goals and planning factors. We also have our 2016 plan that had some really strong goals and objectives that we were looking at. And then we were looking at our other Missoula plans. A lot has happened in the last 4 years. And so we wanted to take all of that and craft what we called our mobility values and the goals that we have for this particular plan update. So those goals that we have developed include improving safety and promoting health to enhance our quality of life, knowing that transportation is a really big piece of how people go about their lives, and making sure that there are options to increase our public health and really improve that quality of life so that people want to continue to live in Missoula today and also 30 years in the future. We also heard a lot that we need to focus on advancing sustainability and thinking about community resilience to protect our natural resources and address climate change. And this is really important, particularly thinking about what's happening now, but also just as climate change continues to affect us. Are we a resilient community? Are we resilient to things like pandemics, wildfire, all of these pieces that affect us here in Missoula? We also really want to expand mobility choices so that our transportation system becomes more efficient and is accessible for both people and goods. And again, coming back to that connection with the urban and rural, we want to connect and strengthen communities to create a more equitable region. So both connecting the urban and rural, but also thinking about how transportation plays a role in social equity. So how are our most underserved populations being supported, and making sure that transportation is accessible to those folks. And then finally, the goal, last goal, is to maintain our assets and invest strategically to boost our economic vitality. So drawing that connection between our transportation system and our ability to be successful as a region. So we did a lot of work. That's all the work that we've done over the last 4 to 6 months, which brings us now to where we're at in thinking about what are the projects that might help us achieve those goals. And so we have a number of resources out on our website where we're trying to collect information from people on what are the needs and what are some projects that might help address those needs. So trying to identify those areas that we really need to focus on for new projects, areas that might not have all the transportation infrastructure that they need. The types of projects we're looking for could include any mode. So that could be sidewalks or trails for walking or biking, additional bus service, improved facilities for driving. That might be safety improvements or additional access or whatever that might be. And we have a simple online form or an interactive map that you can use to submit those. Again, we typically would like to do this in person, and if we were able to meet, I would have maps here for all of you to draw on and provide that input, but we're sort of stuck with virtual for now. So we have all these through the website, and these call for projects is open until July 31st. So there's a couple of weeks left for that. If you don't get it by July 31st, which is next week, we'll still take those ideas and continue to use them as much as possible as we continue on. And so this is an example of what that map looks like. It should be really easy to use. You can select what type of improvement you want to put in there. It asks for some basic information. You can draw lines on the map, put in points. It's meant to be really interactive, and you can look at what all of the other ideas that people are submitting. So once we have those projects, kind of the next steps of what we're doing will be the evaluation and prioritization. So as I mentioned, we have these goals. We want to turn those goals into a set of projects and investments that will help us achieve those. And so we're collecting all of these projects and programs now. We're going to screen those for eligibility for different types of funding. And then we will score all those projects based on some really objective criteria in terms of how well they achieve our goals. Then we create scenarios, rank those scenarios, and then ultimately the goal is to come up with a prioritized set of projects that we're going to recommend for funding. And this really is helpful, knowing that we're going to get way more project need than we will ever have money to build over even the next 30 years. We see that every time we do one of these plans, that there's just way more need. And so we need to be really effective and efficient in our investments if we're going to be able to accommodate that growth and do it sustainably. So the next steps that we have coming up, we're going to finalize that evaluation and prioritization framework. So once we have all those project ideas coming in, we'll work on screening them, prioritizing, evaluating those for how well they'll help us meet our goals. Review and score those project ideas and then create some different scenarios that might have some different outcomes, and then look at which of those scenarios is the best for the community and how we're going to get ultimately to where we want to be. And so there will be more community engagement in September and October once we've done some work and evaluating those projects and setting up the scenarios and get some feedback. So so there's a lot still to come in the next 6 months or so, and we will try to come back and do some more engagement. But for now, we're really interested in understanding what people's transportation needs are and what projects we might need to include in this plan and think about possibly funding in the next 30 years. So that's really quick going through that presentation. Hopefully it wasn't too fast, but I'm happy to answer any questions, or if there are more detail, or you can always call me or get in touch. And here's our website. It's MissoulaMPO.com is the website, and then / long range transportation plan is where all of this information can be found. And there's some videos that you can watch that explain some of what we do, what the MPO is, and these interactive resources to provide us that information. So I think with that, I'll wrap up talking. If there's any questions, or if I need to go back through any of that because I went too fast, trying to be respectful of time.
Is there any certain person that had a question, or should we open it up to everyone? I'm thinking of time. If there's specific questions, we could ask them now, or Aaron's information is in the chat box. You could send him an email as well.
Yeah, and I can stay on too if folks want to add some questions to the chat box. I'm happy to answer those, or yeah, give me an email, reach out. We can chat in more detail.
Aaron, I really like that you put out there that, what's your big idea? I'd love to hear what people have to say, especially folks who live in areas that aren't typically considered by the MPO. It'd be really interesting to hear what those big ideas are. So please pass them on.
Yeah, definitely agree.
Just a curiosity here. This is Emily from Bonner Milltown area. What have other communities done from getting that driving alone to getting that to using those alternative modes? I assume like safety, access, and money. Any others that really drive that to actually make that a change in a community to actually use that?
Yeah, one of the best things you can do as a community is as I mentioned, that land use, like how we're growing and developing. So making sure that there are things like childcare that are close to where people work and live, because if you're biking or taking the bus to work and you have to drop your kids off at daycare or school, that can be a barrier for people. Being able to walk to the grocery store, so having enough houses or residences near services like grocery stores is a really key part to that. And then also making sure that you have a good mix of jobs that are close to where you're developing. You don't want to have areas that are just miles and miles of houses, because it just gets to be too far for people to really walk or bike. And it gets hard for transit to serve areas that are really spread out. And so thinking hard about that, how we're growing, is going to play a huge part in whether people are able to bike or walk or take the bus. And then all the things you said, safety is really key. If people don't feel safe, they're not going to do it. So.
Great. Thanks a lot, Aaron. So our next topic, I hope Chet is still here to chat about our summer river parking.
Hi, Josh. Thanks. I am still here. And I apologize. I'm multitasking. I've got a kiddo playing a baseball game, so I apologize if there's some cheers. But anyway, yeah, summer is definitely here. I think we've seen a ton of folks getting out, trying to cool off in the last few weekends. And so I wanted to talk a little bit about some changes that have come about earlier this year that do affect some of the river parking. And I assume there's probably folks on this call who will be particularly interested in what's going on, and then just seeing how busy things have been, what sorts of ideas or plans we have moving forward. So to give you a little bit of background, there was a resolution passed by the commissioners back in March that basically limited the parking from the junction of Highway 200 and Tamarack Road to all the way to the entrance to the Milltown State Park there, to the confluence area. And for those of you who are familiar with that area leading from Highway 200 down underneath the interstate bridges, I think we've all seen when cars are backed up, clear up to Highway 200 and clear past the auto salvage place, underneath the bridges. And so that's been a long safety concern it comes with all sorts of issues associated with parking where we really don't have capacity and ability to park cars. So that was a culmination of work between FWP and the commission to say, well, now that the park is finally open and able to accommodate some of these vehicles, we need to direct folks to the more appropriate place to park, that being the state park. So the rule went into effect, and signage and some initial outreach for media releases happened in late May, realizing that you don't see the tuber hatch, so to speak, until kind of this time of the year when you have that perfect mix of warm air temperatures and river flows dropping. And so now we're seeing that activity come on. And so, like I said, these past couple of weekends have been pretty busy down there, and we have had not the best success, I guess, with folks parking in some of those places, not for a lack of trying. It just really has been the case that we've seen so much use that the demand for parking spaces has really outpaced our ability to provide it. And so there's been quite a bit of collaborative effort amongst a group called the Three Rivers Collaborative, which is essentially several agencies, business owners, et cetera, that are all involved with river recreation in Missoula. And so there's been a number of discussions, not only about this particular area, but throughout the Missoula Valley as to how to deal with these issues where they pop up. So there have been a number of conversations with those folks. There's been a number of coordination meetings and discussions amongst the law enforcement entities. So most of that is the sheriff's office, as well as Fish, Wildlife, and Parks wardens, working again, as I mentioned, between the county, where we have the ability to put something in place like a resolution in conjunction with the state parks goals and objectives, and having some combined outreach and information going out, as well as now looking at maybe some volunteer opportunities for folks who are part of that more of the Three Rivers collaborative effort to help out with getting the message out there and directing folks to where they need to park, et cetera. So the tuber hatch is on, as we say. So many folks we'll sort of talk about that, and really it'll extend. I think every time we have a busy weekend, we should expect to see folks looking for water. And I would say as a whole, that's the case almost everywhere. I know whether you're up at lakes in the Sealy area, or you're here around the rivers, or even just anywhere where there's water, it seems like the parking lots are overflowing. And I think there is sort of this perfect storm of sorts where we've got weather that's conducive to getting out there, and then everyone is just been cooped up, and I think really looking for some recreation and ability to get out there and just unwind a little bit. So we'll continue to probably see this activity throughout the rest of the summer until we get further into August, probably late August, really, where school and other things start to become more of a priority. Although, as we know, there's plenty of things up in the air there. So for those of you who are familiar or have observed, at least over the course of the past couple of weekends, how busy it has been out there, I just wanted to give you a little bit of a sense of what are we doing about it, because I know there have been a number of concerns and folks that have been frustrated that live out there in that Tamarack Juniper area about just the volume of cars and parking, even where there are no parking signs posted. I believe it was last week that someone went out and actually painted over a number of the no parking signs. I think there was a total of about 21 of them that were painted over. So we have an uphill battle of sorts trying to encourage and educate the public in not parking in those locations. I'm not surprised by that. I think it's always a little bit difficult to change the norm and the habits of folks from one thing to another. So we're going to have to just stick that out and sort of play the long game on that. And I'm sure with the collaboration and coordination that we have, that we'll be successful. But we have had some of those initial challenges. This Monday, we did have a debrief with some sheriff's office deputies that have been working out there on the weekends, as well as with some Fish, Wildlife, and Park staff to talk through just a little bit of what we've been seeing over the past couple of weekends, and then brainstorm a little bit of discussion about how to move forward and what sorts of things we might consider to be more effective out there. I mentioned the effort to try to see if there's ability to get some volunteers out there just to help spread the word and get some additional instruction to folks on where they can park. And what other alternative options they can consider that we would prefer them to do. We've been looking at doing some more social media posting that's surrounding that same message that was part of the initial media release. trying to get out to that particular user group. It's really hard to target that recreational float group. They're not necessarily the types of folks who are going to pick up the Missoulian and read a press release or an article, not necessarily going to pick it up on the radio or on TV news outlets. And so we're looking at some creative ways to try to connect with those folks where they may be getting some of their information. And those are coordinated efforts to come out from one source and then be shared amongst that Three Rivers Collaborative so that we can hopefully get those out to a broad network of audiences. Continuing to have more discussions with the folks involved in the Three Rivers Collaborative, just talking about how we might explore these issues into the future, knowing that this is probably not the only place. And if we do have an effect on limiting the amount of use there, in terms of parking capacity, it's probably going to have to go somewhere. And so we know that we're going to probably have challenges in other locations. And we have had challenges in places throughout the county in the past, places like Kona, out to the west of town. So continuing to have those conversations. We also, in the case of the parking right there immediate at Tamarack and Juniper, looking at whether or not we might actually have some increased parking capacity. So in locations past that hairpin turn underneath the bridges and then headed more toward Milltown State Park, whether we could maybe pull back on some of the signage that has limited parking to allow for some more parking capacity. We were visiting with the park manager, Mike Custodia, earlier today, and I think he mentioned that there was about 4/10 of a mile that we might be able to consider for some parallel parking along the road that would at least be out of the way of some of those immediate residences, and then also limit any issues or concerns that there might be with any safety issues. So looking at whether we might be able to actually fit a few more folks in that area for parking. And then also trying to look at more of a long-term solution, and that is whether or not there's an opportunity to collaborate with the university or collaborate with Mountain Lion to consider some transit options. And I don't know exactly what that would look like. It would probably depend on what routes they have established and what sorts of requirements they might need in order to put some additional capacity out there, but really seeing that as an opportunity to limit some of the vehicle traffic and really give folks probably a more convenient opportunity to head out of town and then float back into town and maybe catch a vehicle that's parked in a parking lot there. So we're working, in fact, just some emails going across later today on trying to coordinate a meeting to have some of those discussions with the university's transportation folks as well as Fish, Wildlife, and Parks. So I'm hoping over the long term there might be a somewhat solution there. And then also looking at some of the areas in that proximity as well. Sharon fishing access site there right out of East Missoula is another hotspot, and I'm sure many of you have seen vehicles parked along Highway 200 adjacent to that fishing access site. Starting to look at some solutions there as well. And I think what we're talking about in terms of approach and transit options, et cetera, all have some applicability there in trying to figure out how we manage really, like I said at the beginning, just folks really wanting to get out there and cool off and taking advantage of the recreation here around town and the access sites that we have. It's a blessing to have those available here in Missoula and have the rivers here, but it certainly presents some challenges. So I think that's kind of the nutshell I wanted to provide. I was trying to keep it a little bit brief here. Josh, I know you've been intimately involved in a lot of these conversations, so certainly want to give you a chance to weigh in on anything I may have missed. And then if there are questions or concerns, certainly happy to hear those as well.
Well, thanks a lot, Chet. And that was super complete. And your leadership and coordinating abilities among all these different agencies has really helped in the recent past. So I just did want to toss out, because I'm nervous that people would see this situation out there and say they need to do something. And we were aware of this about 1.5 years ago and took some action in that we created 3 positions at the sheriff's office that were school resource officers in the wintertime and specifically river recreation site deputies in the summertime. And then it took months of collaboration and thoughtful work with FWP and state parks to take away some parking places and create some new ones. And we tried it, and man, we learned a lot in the first big hot weekend. Like, oh, we need to adjust. And this is a trial and adjust, and that's what we're going to keep doing. And we're going to keep trying and keep adjusting until we get it right. I think you aptly pointed out there's some long-term solutions here around transit and getting people to do other things than drive their own car out there that ultimately can help a bunch. And we're getting closer to a long-term solution at Sharon too. So it's horrible to have to say be patient, but we are working on it and fully aware of what's going on. So that's all I got. But thanks, Chet.
Yeah, Josh, I might just add, I know this is not a problem just within the Missoula area. The Blackfoot sees a ton of activity as well, and I know Commissioner Vero had shared that there were some parking issues and appreciation from folks up there about enforcement issues along Sunset Hill Road that was tied to recreation up on the Blackfoot. So folks are getting out everywhere, and I have to appreciate law enforcement because they're spread pretty thin out there and they've got to cover a lot of territory. And so we're doing as great a job as we can. I will say, having actually spent some initial time in another job working on the Blackfoot during sort of the craziest times of the Johnsrud scene, if any of you are familiar with that, the collaboration amongst agencies, which I feel has really been an integral part of our conversations and efforts so far, tied with really staying tuned in and keeping some pressure on and just kind of, hanging in there was really successful, and it did turn the corner there, and I have no doubt it will here as well. But unfortunately, Josh, I think hit it on the head that a portion of this is being patient, although we're working on more short-term solutions where we can have some low-hanging fruit options as well.
So for any of you all who live out in those areas have questions, I would feel free to ask them.
Hey, this is Lisa from East Missoula, just up the hill from Sharon. And I heard at a previous meeting about plans for a lot of great ideas for the Sharon parking and whatnot. But another thing that might be faster is particularly an air hose, an air filling station somewhere there, so people aren't driving on Highway 200 trying to keep those inflated tubes or their inflatables that they're bringing. They could actually inflate them at the river site. And there was talk about having one maybe at a bus stop or something like that, which might be more long-term. But that would make East Missoula and the number of people driving with things flying off their cars, that would be a safety thing that might be maybe put in the short term rather than long term or something. Not sure, but that was an idea from a previous meeting that really was one of very many good ideas.
Yeah, thanks, Lisa. That came up here just the other day as we were talking about the transportation piece, trying to figure out, if you're going to get a lot of folks in a bus, of course, the inflated tubes or whatever floating device, whether it be a unicorn or any other inflatable thing it seems like you can find these days, having that ability would certainly help with the transit. So I appreciate that, and I think you're right. I think there's probably a place to fit that in that helps us get there.
Thanks.
Chet, this is Kevin in Lolo. Hey, as far as 93 headed from Missoula to Lola, right at the Bunkhouse Bridge, there's also quite a bit of park. What's the plan there? Saturday, I saw a couple kids changing into their swimsuit in the right-hand lane of traffic, just not aware of the situation at all. Something bad will happen there.
Yeah, Kevin, that's been a tough spot, I think, for a long time. There has been some effort, and I'd have to go back and do some digging in emails. It's been a while ago since I'd been privy to some of the discussions, but looking at changing some of the access there, I'm sure you're familiar with that. There used to be sort of free reign parking there, and that's mostly private property that surrounds that space. And so I think there have been a number of conversations over the years about more of a recreation site there. It just hasn't seemed to materialize, but that's another one that fits in that Three Rivers collaborative conversation. And so, and that's really the intent of it, is that we don't just have these isolated areas that aren't part of where we're focusing our attention. And in reality, the issues are the same everywhere. So that's what I would say, is that that's part of that discussion. The other thing that I had in my notes that this has made me think of is that one of the products of the Three Rivers Collaborative is working on some Missoula area float maps. And so that's another part of that outreach and communication effort. I don't know exactly where that site in particular is in terms of ideas or concepts, but certainly something that's part of that conversation.
Is there a contact for maybe an email I'd like to have them come out to our next Lolo or participate.
Hey,
on
Kevin,
internet.
I've got all that. I
Oh,
have all
awesome.
that. Yep. I'll hook you up.
We'll invite them to present so we can help educate. Because a lot of those people getting out started in Lolo. So
Yeah,
okay.
yeah. No, that's great, Kevin. And it's been a little quiet on the Three Rivers front. I mean, they've been affected by some of the COVID changes as well. I'm involved with the steering committee that helps to pull those meetings together, and we're actually meeting tomorrow, actually, to talk a little bit about that, so I can pass that on. There isn't necessarily a key person or figure that represents the Three Rivers Collaborative. It's truly a collaborative in that broadest sense.
Sure.
So we'll figure out if you had some questions or some things maybe to send that way, we can make sure we get the right folks there to answer, just because there's so many diverse interests as part of that group.
Okay, sounds good. Thank you.
Any other questions?
Great. Well, thanks a lot, Chet, and thanks for everybody's comments on that's a tricky summer issue. Okay, our next up is Dave, who's going to talk to us about the rail authority.
Thanks, Josh. And I'll make this really quick, and maybe we could hit on it in a little bit more detail in a future meeting since we're just about out of time. But Aaron talked a little bit earlier about, as we shape this long-range transportation plan, thinking about what big ideas we have for the future of transportation in our community here in Missoula County. And this is one of them. If you were here in 1979, you probably remember that the North Coast Hiawatha train passed through our community, and you could jump right on it there at the north end of Higgins Avenue and travel to Chicago or to Seattle or Portland. Well, ladies and gentlemen, I think the time has come that we revisit this and take another run at seeing what we can do to restore passenger rail service to southern Montana, and that includes right here in Missoula County. So the one thing I will just hit on quickly and leave you with, and we can revisit this maybe at a future meeting, is that Missoula County has spearheaded an initiative, and I will share my screen with you just to give you a visual of this. We have spearheaded an initiative to establish what we are calling the Big Sky Passenger Rail Authority for the state of Montana. Can folks see the screen?
Maybe make it a little bigger.
Yeah.
Make it a little bigger, okay. Better?
Great. I mean,
A little smaller.
okay, sorry.
Smaller?
Yeah. There you go.
Perfect. Okay. Well, that's as good as it gets tonight. So that's the state of Montana, as you all know. So basically, since we lost passenger rail service 41 years ago, we've had various attempts to try to get it back. And one thing that we've been lacking that other states have is something like a rail commission or a rail authority. Here in the state of Montana, counties are uniquely positioned because we have the ability by state law, if 2 or more counties adopt a joint resolution to establish a regional rail authority, we can do so. So what you're seeing on the map here in green are 12 counties as of this morning who have agreed to participate in the establishment of this passenger rail authority. The authority will be really the vehicle by which we are able to do analyses, seek funding, lobby for, officially as an institution, lobby for the restoration of rail service to the southern tier of the state, be that the east-west route that many of you might have been familiar with, or even earlier there were passenger rail lines that extended from Denver up to Billings and from Salt Lake City up to Butte and Silver Bow County. So with that, we are in the process of officially adopting this joint resolution. Missoula County will have a public hearing on the resolution on July 30th. Gallatin County will have theirs on July 28th, Butte, Silver Bow, early August. And once we adopt this resolution, we will appoint an initial board of directors to the authority, and we are off to the races. So if you have an interest in seeing passenger rail restored to our part of the state, feel free to weigh in both with us as commissioners, but also I would encourage you to write our congressional delegation, Senator Daines and Tester and Congressman Gianforte. Let them know that this is a priority for you, because if we don't let them know, they will assume that it is not. The one last thing I will leave you with is that on September 17th of this year, Missoula County will be hosting a passenger rail summit. I will type in the link into the chat box, and we would love to have as many of you as possible to join us for that event. It should be a great opportunity to learn more about what passenger rail from an economic development, from an environmental, from a social justice and transportation justice standpoint might mean for the state of Montana. So with that, I will stop right now, and I don't think we probably have time for questions tonight, but I would certainly welcome any of you to reach out to me and get engaged. Thanks.
Dave, I just wanted to add something. I'm not sure if it came through in what you were saying. On the map, all those counties in green have joined up. So
yep, 12 counties. The ones in gray are hopefully going to be shamed here at some point and feel some bit of pressure to come on board, but it is still not too late. So if you know folks who live in Granite, Powell, Deer Lodge, Sweetgrass, Stillwater, Yellowstone, Treasure, Rosebud, or Custer counties, or Lake County up there, by the way, and Lewis and Clark County, get on the horn, tell them to contact their commissioners, because even though we've got enough counties now to establish the authority, we want as broad and deep of representation on this authority board as possible.
Hey, Dave.
Yeah.
If you guys want some more information on that, you look in the July issue of Trains magazine. There's an article in there about your coalition and asking for people to join in on that. So it is publicized in a national magazine.
Well, great. That is fantastic to hear. And I would say that, and this is important for a meeting like this, where we are all hyper focused on a lot of important issues here in Missoula County and in our community council areas, but there are times and there are opportunities where we can work across jurisdictional lines and accomplish something bigger than what we can accomplish individually in our small areas that we represent. And I think this is one of those moments and opportunities.
Well, when I was a kid, I used to ride the passenger trains number 1 and number 2, east and westbound, from here back to Minnesota. So clear out Sandpoint. Anyway, we'll let you go.
Thanks.
Great. So thanks, Dave. It's super exciting. I'm really, it's been awesome to watch this thing go from an idea to having all these counties jump on, and it has a head of steam. It's happening. Sarah, do you want to chat with everybody about some board vacancies?
Sure, Josh, just real quick. Wanted to put in a plug for some boards that could use some help finding members. So out in Clinton, the Clinton Rural Fire District has unfortunately lost 3 members this spring, and so their board is down to 2. So if any of you know someone out in Clinton area who could represent on the fire district board, that would be helpful. And then Evero, Finley, O'Keefe Community Council, if anyone knows someone up in that area, their board is also down to 2 members, so they're struggling to get meetings to happen. And then we have the Sealy Lake Cemetery District Board up in Sealy, who lost a member this spring as well. So if you're up in the Sealy area and know of a qualified candidate, if you could send them my way. And then the Election Advisory Committee will be having some new seats open up here shortly, and there will be a press release coming out probably next week about that. So I will, if you don't mind, send everyone on this call a press release for those board vacancies. And if you know of any qualified candidates, please help us get the word out. Thank you.
Thanks a lot. On that Election Advisory Committee, we really could use some rural representation. So please pass the word. So with that, I think, Sarah, correct me if I'm wrong, but I think we are out of time.
I think you're right, Josh. Unless someone has a burning question that we didn't answer.
Yeah. All right, so do we have a date for the next time we're going to do this, Sarah?
Yep, so I've created a reoccurrence for the fourth Wednesday of every month so that everyone can
Perfect.
get that on their calendar and plan for it. Same time, fourth
Great.
Wednesday of every month.
All right, well, we'll see you in the fourth Wednesday of August, and thanks everybody for coming.
So I'll make a motion, we adjourn.
There you go. Adjourn it is. Bye-bye.
Thanks, everyone.